today we're going to be talking about capacity for care. And it's kind of a buzzword in our industry, right? Everybody's like, what's your capacity? Are you guys within capacity? What is capacity? So let's figure that out first, and then we'll figure the rest of it out. So capacity, according to Merriam-Webster, I'm a word person, so I always go to the dictionary first. So according to Merriam-Webster, capacity is the potential or the suitability for holding, storing, or accommodating something. So like a large seating capacity, like this room has, which for a combined track is actually pretty good for the end of a conference, so thank you for staying. Or B, it's the maximum amount or number that can be contained or accommodated. And that's the definition we're going to be talking about today, a maximum amount. And so, for example, if you have a jug that fits a gallon of water, the maximum capacity of that jug is 1 gallon, right? That we call it a 1-gallon jug because it holds 1 gallon of water. You can put less in, that's fine. You might be thirsty later. Or the auditorium was filled to capacity. These are the definitions that the examples that they give in the dictionary. And so here's Dr. Sarah Paisano, who is lecturing about her new book that just came out about the shelter handbook in a very similar classroom to this one. It's actually the one on the other side of this wall. And as you can see, we had a fairly nice capacity of crowd for the first 3 rows anyway. What you don't see is that the last 4 rows are also completely empty. When I think of capacity in the animal shelter, this is sort of more like what I'm thinking about. We have a primary enclosure for our animals. We have a certain number of animals that can fit in our shelter, whether it's in that primary enclosure or in the shelter building itself. And hopefully we're looking at the one on the right at your shelter and not the one on the left, right? Because the one on the left, they have some welfare concerns, especially the one that's just bones. Yeah, so this is Tompkins County SPCA. This is the building that we do a lot of our teaching out of. And some of the numbers that I'm going to be talking about today come from this building, but this is a kind of a small building, and some of your shelters are going to look like this and some of them are not. And that's the other thing about capacity is that, hello, do it again. Oh, we're going to talk about the definition and then we're going to get to why it matters what your shelter looks like. So if you look at the definition of capacity for care, it's really actually hard in the primary literature to find anybody that defines it very clearly. So in animal sheltering, generally it's the number of animals that can be properly cared for based on various constraints that you might have as an animal shelter. So if you have the capacity for doing, say, 50 surgeries a week in your shelter, but you're taking in 400 animals that need surgery every week, it's probably over capacity. Make sense? In Dr. Paisano's best practice playbook that we just talked about, she says that capacity refers to appropriate enclosures, availability of staff, volunteers, and other resources to care for pets, meeting the emotional and physical needs of each pet. In Dr. Karsten's recent paper in the Veterinary Journal, where she talks about capacity for care in 3 different shelters and how meeting that capacity helped those shelters, she says the optimal daily population, which is her definition of capacity, meets the health and welfare requirements of all animals while maintaining or improving the shelter's goals or mission for adoption and other positive outcomes. So we might recommend to a shelter that their capacity be a certain number, but when we do that, we don't mean that you should euthanize everything else. We mean that you should do it in a way that's positive and that everybody is getting adopted or everybody is getting transported or there's some life outcome in the mix. And then Dr. Janke uses this term C4C. I don't know if you guys have seen that. It's a Canadian thing. They have a C4C program that they are introducing in their shelters across the Canadian country. And they use several strategies designed to achieve the overall goal of maintaining shelter capacity while simultaneously attempting to improve instrumental aspects of animal shelter, including adoption rates, length of stay, and incidence of illness. So that's all the things that they're looking at when they're looking to see what their capacity is. This is pretty dry, right? This is all sort of academic and may not seem like it, you know how to apply it to your shelter. What I was getting at when I put that picture of Tompkins County up here is that size matters. And so if you have a small shelter, you can do a lot of really great work, but your capacity is not going to be as high as maybe a bigger shelter. So this is the Poets and Boats. This is in Amsterdam, and it's a boat. It's a houseboat. It's about 1,000 square feet, and it's a cat shelter. And they have cats. They have some in cages. They have others that are wandering around in this shelter. They adopt out a certain number of cats every year. Let's contrast that, though, to the ASPCA's adoption center on 92nd Street in New York City. a little bit bigger. Oh, in fact, it's a lot bigger. And they're able to help a lot more animals, but they also have a lot more people who are coming and looking for them, and they're not on a boat. So the Puts in Boat adopts out about 200 cats a year, and they receive about 200 cats a year from their community, and so they're within their capacity, and everybody feels pretty happy about everything that they're doing. And if you want to, you can go on a tour if you go to Amsterdam. The ASPCA on 92nd Street and their adoption center adopts out about 3,000 cats a year, about 5,000 pets total. And if you want to go on a tour there, they're happy to accommodate you as well. What is your shelter? Your shelter is probably somewhere in the middle of those two places, right? Or maybe your shelter is even bigger. I know the Lollipop is about 10,000 a year. Is that right, Rebecca?
We do about 6,000.
Oh, 6,000, okay. About 6,000 a year. So not that much bigger than the ASPCA these days. Might have been bigger in the past. So the other thing I wanted to talk to you guys about in this particular lecture is you're going to hear a lot of people talk about standards. And you want to be careful about what word comes before standard. So we have a bunch of standards that are gold standards. So those are, if you're going to do something the very best way possible. So let's think about a hotel, right? What's the very best way possible? This is my definition of the very best way possible. This is Hawaii. This is some sort of huge resort. I'm not really sure which one. I just took this off the internet. It's not like I've actually been there. But then there's basic standard. And we're in the animal sheltering industry, and so I want you to pay attention to this, because this is basic standard, right? Temple Grandin said, I like staying at the Marriott, but the Motel 6 is adequate welfare. And she's right. Like, we can get it by staying at the Motel 6 for a little while before we go a little bit crazy. But I could stay in Hawaii for a long time before I think I would go crazy. And then there's, less than minimum standard, which might be okay for a very short period of time. So the analogy in the animal shelter would be, say, an airline crate for a cat. It's not an appropriate primary enclosure, but it's okay to do it maybe for a little while. And this is what I think of when I think of that. I stayed in a capsule hotel in Tokyo one time. I'm not a short person. I had to sleep with my toes up. It was not very comfortable for me. Other people probably would have been better. It also found that if I slept on my side, I could curl my knees up and it was okay. But I do it for one night, but I couldn't do it for another night. I just couldn't. That was not good quality of welfare for me. But it might have been for somebody who's like, 5'5" or lower. So where do these standards that we talk about, these best practice standards or these minimum practice standards come from? Well, there's a number of different places where people get their evidence from. And I also want to point this out to you guys. So when I'm telling you something and I'm saying why we think it's the case, and I say, well, there's been some studies for it, this evidence-based research is really the one that we trust the most. Because unless you do a study on something, you don't know if it's actually working the way that you think it's working or it isn't. Because nobody's tested it. Nobody's looked to see. And after that, we have community consensus. And I put this up here pretty high on this graph for sheltering because a lot of the decisions that we make are based on ethics and what we think is going on for welfare and what we think is appropriate for these animals. And it may not be based on science, but it's based on our view of how we think things are when they're right. And I think that has to matter, right? We have to be careful about that too, because sometimes the community has a different idea than maybe what we do about what we're doing. And so in that case, you should do a study. We also do a lot of extrapolation from people, and that's not a bad thing at all. How do you know that having a loose tooth hurts as a dog? Well, having a loose tooth as a human hurts. So I can imagine, since they have the same nerves, they have the same connective tissue, they have the same sort of brain, we're not that different from them genetically, that it also hurts them when they have a loose tooth, or when they get punched in the face, or when they get hit by a car, or any of these things. And so if I look at an animal and they have a condition that I would want pain medication for myself, I think it's a good idea to give that dog pain medication, even though I don't have a study that shows exactly how painful it is to break a leg as a dog. We also have expert opinion. That's what you guys get to listen to today. That's me talking to you. And some experts are experts in a field of study like dermatology, but they only treat clients owned by people who have a lot of money. And then sometimes people are experts in shelter medicine, but they don't know a lot about dermatology. And so just be a little careful about the context of the information that you're getting from experts, because sometimes things are just really complicated, and we're really good at complicating the questions that you ask us because we know too much about something. And then the people that are very clear, that are very sure, that have an exact answer and you need to do it this way every single time, most of the time they're not the experts. Because for experts, everything is always gray. The last on the list here is anecdotal evidence. So that's, hey, this one time, this one thing happened, so now every time that one thing happens, I think it's going to go this way, which we see a lot in clinics. So that's clinical experience for us. We may have treated 3 cases of something and it worked out well for 2 of them. That's anecdotal evidence at this point. It's not science. And so we often have feelings based on anecdotal evidence as experts and then look at the literature and see what that says and realize that, oh, actually, my perception of this is probably not exactly correct. So I'm going to go with the evidence-based and not the anecdotal because I trust that more. And then there's history and repetition, which is really important in the shelter. Because how many of you guys have asked people why they do something some way, and they've said, well, because I've been doing it for 20 years this way, right? And then you're like, well, how about this other way? And they're like, no. We do it this way because that's what we've always done. And that's the least reliable way to know that something should be a standard. Just because you've done it doesn't mean you need to keep doing it, although it is easier than change. So in addition to being sort of on a scale of most trusted and most entrenched, these are also sort of the rarest and the most common. So the most common reason that people do things a certain way is because they've always done it that way. And the rarest reason that they do it is because they've read the really latest research. Ooh, try to say that 3 times fast. They've read the latest research, and they have now changed their protocols to reflect that. So there's a paper that came out about 5 days ago on ringworm that says that probably if you do culturing really well, you only need to wait for 1 negative culture. 5 days ago. I may have already kind of done some preliminary research on this and come to the same conclusion, so I'm really happy that they wrote that paper so I don't have to. But now I get evidence to tell people why I think that maybe 1 negative culture is just fine for your ringworm cats. And we can get those cats out of there an extra week early, which makes me really happy. So now that you guys have listened to me get on my soapbox about standards, these are some of the standards that I'm sure that you have come across in our profession. So this is the Association of Shelter Vets spay-neuter guidelines. So this is a number of standards that they would like people who are doing spay-neuter in the shelter to follow so that we're all on the same page. We all have an idea of what we think is not best practice, but at least worst practice that you can do and that you should do in the shelter. If you haven't seen it, there's a new version that came out in 2016. I recommend you check it out. And then there's this Guidelines for Standards of Care in Animal Shelters, which I'm sure you guys are all familiar with. But this is basically the minimum standards most of the time, although there are some ideals also in this document, of how we need to operate our shelters in order to meet the welfare needs of our patients. So it's not a best practice, it's a standard of care. Does that kind of make sense? And these are based on all of these different ways of getting standards. And sometimes they're based on history and repetition because that's the only data that we have. And sometimes they're based on the best evidence-based research. And that's what we prefer when we write documents like this. But sometimes it's just not available because nobody's done a study on that particular thing yet. And so we're working on it. We're working on it. What is proper care in the shelter? What is that minimum standard? Well, we talk about this a lot, these 5 freedoms. How many of you guys have not heard of the 5 freedoms? Hold up your red card if you haven't heard of the 5 freedoms. There are no red cards in this room. That's amazing. Thank you. So I'm not going to go over these. I'm going to spend a lot of time. This is the version from the ASV guidelines, but those original 5 things were brought up by the Bramwell Commission in 1969 when they were discussing livestock animal welfare in England. And they came up with these 5 things that if you can meet these, then you are meeting the welfare needs of those animals. And that's all you need to do. But these are kind of aspirational, right? So we're aspiring to make sure that they have a freedom from hunger and thirst. But how do you do that? Well, you have to feed them the right kind of food. Well, how do you know what the right kind of food is? And so you can get kind of back and back and back in these. It's not really a guideline. It's just the goal, right? So in the shelter, this is kind of what we come up with. And this is sort of a quick list of things. And if you notice that your shelter isn't doing these things, you should be thinking that's sort of a red flag. So vaccination on intake, deworming, spay, neuter, vet care, right? Pretty basic, right? The basic standard. Large or double-sided enclosures for all of your animals that are clean most of the day. Seems pretty basic, right? Hiding places for cats. At least something to hide in. Doesn't have to necessarily be a box, but they could just be behind a towel, that's fine. Daily walks for dogs. Even the ones that bite. Maybe it's just exercise. Maybe they get to go out into a run. That's fine. 2 meals a day and treats in between. Some people are still feeding 1 meal a day in the shelter. While nutritionally that might be sufficient, enrichment-wise it's probably not. A soft place to lie down. Maybe it's just a towel. Maybe it's a Cornell bed. Maybe it's something new, fancy, newfangled, a couch, I don't know. It's fine, a soft place to lie down. Behavioral enrichment. So, walks count, but so do, frozen popsicles, so do Kongs, all those things. But everybody should have some sort of enrichment every day, dogs and cats. Time with other animals when appropriate. So don't put dogs that like to kill other dogs with dogs, right? Don't put cats that like to kill other cats with cats, or dogs that kill cats with cats, sort of thing. Don't do that. And don't mix litters of kittens just to give them enrichment. Not a good idea, biosecurity-wise. But if you have animals that like the company of their fellow kind, then, play groups, or maybe like a play group for cats that like each other. We have a lobby at Tompkins County where we have cats that live in individual cages. And sometimes we'll find that cats like each other, and we'll let them both out of their cages at the same time to go romping around and sometimes crawl on the rafters, 30 feet above our heads. It's fun for everybody involved. Especially when you're like, do I need I don't know, what do they call this, little trampolines to catch them as they're falling down? And then the other thing that's on here that I think people forget a lot is a daily pathway check. And this is somebody who looks at that animal and says, what can I do to get you out of here faster today? What needs to happen? And this is part of daily rounds, but this is something that is standard care in animal shelters. Not necessarily sanctuaries, because that's their home for life, right, unless they accidentally get adopted. But for animal shelters like ours, this is standard of care. And if somebody is not looking at that animal every day and saying, how can we get you out of here faster? They should be. So, you guys ready to calculate some capacity? Yeah, okay. This is what you'll need. Phone or calculator. Here, everybody has one of those, right? Mostly phone, not necessarily calculator. Or paper. You can do this all by hand if you want to. And then these are things that, if you want to do this for your own shelter, you might need, but you can gather later. So statistics like intake rate or length of stay, adoption rates for different animals, the number of humane enclosures that you have at your shelter, number of staff cleaning, how many there are of those staff when they're cleaning, and how fast they are expected to do that. Are they spot cleaning or are they deep cleaning? And how often and which one? The time needed for a behavior assessment. The time needed for a spay-neuter. The time needed for the budget, the money that you need that you can take care of each animal for. And then you also need this today, your sense of humor and some creativity. So, okay. I'm also going to tell you the calculations that you're going to need to know how to do, because it's actually not hard, but I want you to sort of help you think about this in sort of a business context instead of just sheltering. So incoming animals over time is a rate. And in this lecture for right now, for the sake of humoring me, we're going to call this lambda because it's a rate. Rates get little Greek letters. And then we're going to talk about length of stay, which we're going to call W here. And you think I'm crazy for assigning these letters here to these concepts, but bear with me for just a second. This is the time span that an animal spends in your shelter from intake to outcome. And it may be euthanasia, and it may be transport, and it may be adoption, but that's the whole time that animal spends there. And most of the time when we're doing these equations, we're looking for an average length of stay. So we've got that cat that's been there for 4 months, and we've got that kitten that was there for 2 days before it got adopted, and we're going to average those together and come up with a number that represents most of the animals in your shelter. And then we've got L, which is the number of animals in your shelter. And you can see how this is looking more like an equation, right? So lambda is equal to L over W. The number of animals that come in over time impacts the number of animals that are in your shelter by way of the length of stay. And the reason I'm using these numbers is because this is not something that we invented. This is something that was noticed by Dr. Little in the 1950s. He's an economist and business person, and he noticed that if you have a certain number of items on a conveyor belt and they're moving at a certain amount of time, you're going to have this many items on your conveyor belt if you have this much length of time for them to get from A to B, right? So it works with customers coming into your store. It works with all sorts of things. And you can read these, so the average number of items in the system, but I'm going to make them a little bit more shelter-friendly. So there you go. The average number of animals in the system, we just talked about L, so that's in that shelter box, right? And then the animal intake rate, that's those animals coming in from all the different sources that they come in from. And then W is that average time an animal spends in the system. That's that length of stay, right? But I can do this with different things in the shelter too. So I can make this cages and cleaning. So I can do an average number of cages in my shelter and the time that it takes for my staff to clean those cages, that's a rate. And that's going to be the average time that the technician spends cleaning. So if I have a certain number of cages, I need to know how many people I have. I need to know how many people I need to clean them in a certain amount of time. I can use this equation to do that. Number of techs needed. Here are all the derivations if you want them. It's just algebra. You guys all did that in high school. It's fine. So we're going to actually do this in just a second, but I'm going to talk about staff capacity for basic husbandry. First, what I mean by staff capacity for basic husbandry is cleaning and feeding. According to the National Animal Care Association, you should have at least 15 minutes for feeding and cleaning. They didn't put enrichment into the equation. It was a big oversight. But we're going to forgive them for a minute and just figure out how many technicians we need to clean cages if it takes this 15 minutes. Now, is that realistic? Depends on your shelter and your cages and if you're spot cleaning or if you're deep cleaning. So what I would recommend doing is getting a stopwatch and timing your staff or timing yourself. Try to find that average person doing it, like sort of the most adequate way. Like not the best person, because they're probably doing it a lot faster, or the worst person, because they're probably wandering off in the middle. You know those people, right? We've all seen those people. But so time about what an average person would take to clean that cage, and whether you're asking about spot cleaning, you're asking about deep cleaning, or a combination of the two that's sort of an average for your shelter, and you can figure this out. So for example, it takes your average animal care technician 10 minutes to clean each cat cage and feed the cats. This shelter, these guys are fast. Cleaning must be done between 7 a.m. and 10 a.m. opening time, right? Because you wouldn't want the public to come into a dirty shelter. If there are 60 cats in the shelter, is 4 enough, or do you need to have 5? Or what? So do this problem, and then when you have an answer, if the answer is yes, when I ask you to, please hold up the green card, and if your answer is no, when I ask you to, please hold up the red card. But don't tell your neighbor. Keep it a secret. Actually, you can work with your neighbor if you want to. Feel free. But I'll ask you for your answers. I'll give everybody a chance to work through it, and then I'll show you how I did it. I'll show the work. For those of you that are wondering, there are 60 minutes in an hour. I didn't give you that, sorry. Yeah, this isn't some weird fantasy land where there's different times or days. Okay, so why don't you hold up your cards and tell me what you think. Okay, I have a couple of reds scattered in a sea of green. So this is great. All right, so time per cage, that's our rate, that's lambda. Cages is W, total time is L. So we have 10 minutes for 60 animals, that's 600 minutes. Everybody following me so far? Okay, 600 minutes divided by 4 is 150 minutes per staff, which is 2.5 hours per staff, which is less than 3. So yes, good job. So your staff can do this, that's great. If you only had 3 technicians, they would struggle, right? They couldn't get this done in time, but if you only had 3 technicians and only 50 cats, they could. So you can manipulate all of these numbers. They all will always add up together, or at least multiply and divide together in the same way. But you can manipulate different ones to get to where you need to be. Does that kind of make sense? So you don't have enough people because you have too many cats and you still need to do it in those 3 hours, either make it 4 hours or hire more people, right? You can't just ask them to clean faster because 10 minutes that's plenty fast. Okay, so surgical capacity. We talk about this with technicians a lot, but it's also important for your shelter managers, right? Or volunteers who are trying to help. So surgical capacity is maybe the number of animals that you could do surgery on given a certain time. And that's dependent on some different things, right? How long does it take for animals to get spayed and neutered? Is it a big pit bull? Is it a tiny little kitten? Well, 20 minutes, 5 minutes for me, but maybe you have a surgeon who's just graduated from college and vet school and isn't quite as fast as that, right? Number of days that the procedure is taking place. So if you do surgery at your shelter 1 day a week, but you have 500 animals in your shelter that need surgery every week, that's not going to add up. So maybe you need to add more days, or maybe you need to get fewer animals. You guys could figure out which one of those things is easier. The time of the entire procedure. So it's not just me spaying the cat because I need my technician to prep it and I need it to recover and go back to its kennel. And so taking all of those things into account is important. And then the number of animals that need that procedure on average. And usually it's a monthly thing. So I would go back in your history of your shelter and look. Every July we do surgery on 200 cats. Every January we do surgery on 150 cats. I think that's about right. Maybe even 100 cats in January because you can't find the cats in January. And how much does it cost? So you want to break down how much it costs for dog spays based on your average per year, how many cat spays based on your average per year, and that can give you a good idea of what your surgical budget needs to be. Remember, you have to pay for staff. You have to pay for their time. You have to pay for overhead. You have to pay for the drugs. You have to pay for the DEA license, all of those things, right? That should be in your budget. So here's your problem. In a large shelter, it costs an average of $45 to spay a cat, including anesthesia, overhead, vet tech wages. With an annual surgical budget of $108,000, can the shelter meet the needs of 200 intact female cats and kittens that come into the shelter every month? It's the same equation, just as a hint. All right, I'm seeing some cards. Is everybody sort of ready? Everybody want to hold up their cards? Excellent. I'm seeing a sea of green. You guys are brilliant. Here we go. So money per surgery is your rate. That's lambda. Surgeries are W. Total budget is L. So $45 a cat times 200 cats per month is $9,000 per month. There are 12 months in a year. I didn't give you that. Hope you knew. And that gives you exactly $108,000. Cool. But you've got to really hope that you don't get 201 cats some month or 300 cats some month, and that there's no extra and that there's no waste and that you don't need to have 2 technicians because one of them is going out on maternity leave, but you still have to pay her because you do. But what about cat neuters? And what about dog spays? And what about dentals and amputations? So if this is your surgical budget, you can do those 200 intact female cats for their spays, but you can't do anything else. So not a realistic surgical budget, but it will cover that particular procedure. But you might want to sort of ask the right question to get the right answer, right? So it's also about 20 minutes to prep a kitten for an amputation, in case you're wondering. This one had a grass blade wrapped around its ankle to the point where its foot died, and we had to cut it off because it was causing an infection. So housing capacity is another one. This is the main one that people think about when they think about capacity. But I want to remind you that there's a staff capacity and there's a money capacity as well. Because if one of these numbers is smaller than the rest, that's actually your capacity. That's actually the number that you have to go with because you can't stretch these things. So housing capacity is how many humane housing units you have. And I'm talking about humane housing units. So I'm not talking about those little tiny cages at the very top where you can sometimes put one kitten, but they don't even really fit. Like, that's not a humane housing unit for most cats, right? I'm talking about the portals. I'm talking about the large ones that are at least 8 to 9 square feet for cats, that have hiding places, that have places where you can get their litter box out of their faces. For large dogs, I'm talking about 30 square feet of space for like a Mastiff or something like that. How many animals are in your care at any given time? That's that L, the number of animals in that shelter box. How long are they staying? And that's really the key question, right? Because if I have one cage and all of my cats stay 1 year, I can help how many cats in 1 year? 1. It's not very good for life-saving, right? But if my cats only stay 7 days each, I can help 52. That's a lot better. If my cats only stay 1 day, I can help 365. Well, that's not very realistic, right? So here's your problem. If a shelter takes in 3,000 dogs per year, which is probably about like Lollipop, right? An average length of stay of 21 days, which hopefully is not like Lollipop, are 150 kennels and adoptions and holding enough? I'm giving you a hint. All right, does everybody have an answer? Can I see them? What you got? Ooh, I have one green and a sea of red. Not to, point out anybody who's an exception. So 365 days in a year, which I didn't give you, which hopefully you guys all had figured out at this point, gives you 8.2 dogs coming in every day, which is kind of, a lot for some shelters, but is pretty normal for other shelters, or pretty small for other shelters. The average length of stay of 21 days is your W, and your 8.2 is your lambda, and that's going to multiply those together to get your L for your number of animals in-house, and that is 172. So that is not enough. This cage here, not sufficient housing for 4 dogs, right? That's a lot of dogs in one kennel. I'm all for co-housing dogs. I think they do great. I think it's fabulous enrichment for the dogs that get along with other dogs, but 4 is too many, right? Any questions on housing capacity based on your length of stay? Okay, if your shelter is crowded and is always seeming crowded and never seem to have enough kennels and you're always having to resort to things that you don't want to do to house animals, this is probably why. There are some things that you can do to change within this equation to make the numbers work. So for example, if I only took in 2,500 animals a year, 150 cages would be just fine. If I had a 14-day length of stay instead of 21 days, 150 kennels would be just fine. Or I could build another outbuilding to my shelter and add 25 cages, but I'm not really sure that that's the best way to do this for the welfare of the dogs in my care. Does that kind of make sense? So I can adjust any one of these things because it's an equation. And if I don't like the answer I'm getting, then I need to do that on some point. So have you guys heard of adoption-driven capacity? That's different than what we just did. What we just did was based on the number of animals coming into the shelter. So that's basically intake-based capacity. Adoption-driven capacity is the idea of matching the numbers going out to, actually, the numbers coming in to the number of animals leaving. So it's like having a hose in a bucket that has a spigot. The spigot goes a certain rate. If I don't want the water in the bucket to overflow, I have to make that hose match the spigot. Kind of makes sense? So what we're going to do here is we're going to do some ideals. We're going to do some targets. We're not going to use the numbers that we currently have because we'd end up in the same trouble that we currently are in. But we're going to pick some numbers that we like better. So this assumes that the basic premise of this is assuming that the number of animals leaving is sort of consistent year over year or month over month or something like that. So in general, you have the same number of people that come in every month or the same month every year and adopt the same number of animals. And it's something that you can track actually as a shelter by the adoption rate, right? So if you successfully adopt out 6,000 animals a year, you can use that number to calculate your adoption-driven capacity. Or I like to do outcome-driven capacity, but that gets a lot more complicated because there's a lot more little wiggly bits, but talking about stray, going back home, and euthanasia, and all those types of things. But you can do an outcome-based capacity as well. So it doesn't take those intake numbers into account at all. You just want to put that out there. So if you're confused about how you use your intake numbers for this adoption-driven capacity, you don't. And it's just one metric. I would recommend calculating all of these things. So here we have a limited admission shelter, and they adopt out 500 cats per year, and they want to reduce the average length of stay in their adoptions section to 14 days. Let's say it's 21 now, but they would want it to be 14. They have 30 cages in adoptions. Do they need more? So I've given you a length of stay, and I've given you animals per year. You guys can figure this out. Go for it. Okay, you guys ready? If they need more, do green. If they don't need more, do red. All right. Well, this is really interesting. I'm getting a good mix. This is one where you had to flip the equation around. That's what algebra is all about, right? So 500 cats per year is 1.4 cats adopted out per day, on average, right? Some days you do 5, and some days you do 0, and the average is 1.4. And they stay for 14 days each. So I'm going to multiply that, and I'm going to get 19.6, which I don't want to put a sixth of a cat on the floor. That's gross. So I'm going to do 20 as my number that we need. So if I have 20 cages of cats on the adoption floor, they will each stay for 14 days as long as 500 continue to get adopted every year. Does that make sense? Is 20 a lot of cages for your adoption floor? I think most of us would think that's a little small. But if they're staying 14 days each and you're only adopting out 500 every year, then that's the number that you will have. And if you have 30 cages and you fill them up, they're just going to stay longer because your community only has the capacity to adopt 500 every year. And so if you can slow down the number of people coming in, then if you only had 300 cats getting adopted, it's possible that those cats in those 20 cages would also be staying for 21 days. If you could increase those number of adoptions through, adoption events or better marketing or getting pets into PetSmart or a number of different ways, then maybe you'd get 700 people to come in, and those cats in those 20 cages would only stay for 11 days. But this is how it works. All of those numbers are related. If I wanted my cats to only stay 7 days on the adoption floor, I'd only need 10 cages. And maybe that's better, right? But then where are all the other cats? So that's kind of the issue, right? So that's actually too many cages. And when people come in and they see 500 cages and they're all full of cats, you know what they do? They revert to the status quo, which is catlessness. So having a smaller number of animals on your adoption floor can actually be really beneficial. The concern with that is that you might not have the selection or the type, the one particular cat that one person wants. So a lot of shelters are having a model where they have a small number of cages on the adoption floor, but there's others that are waiting for adoptions because maybe they're still on a stray hold or maybe they're waiting for a dental cleaning or something like that. And if they meet the criteria that those adopters are looking for, those adopters can meet those pets and put a pre-adoption hold on them. And so that's how you solve that Baskin-Robbins dilemma with the, but I only like fudge ripple. Kind of makes sense? Okay. So how many cages do you guys have in your adoption area, and is it too many? And if it is, can you put portals in them and cut your length of stay in half? You could. You could. Oh yeah, and this is this slide. Okay. So what's your standard length? What's a good length of stay in a shelter? What's a standard length of stay? Well, it kind of depends on what's going on with your animal. So if your animal has ringworm, 4 weeks is probably a good length of stay for them, at least under my care, because I have a pretty good ringworm protocol, I think, and we're pretty conscientious about it. But if you don't have ringworm, then that's pretty nice for you. And this length of stay depends on the mission. So if you're a sanctuary and your mission is to take care of animals from the day they come to you till the day they die, it's going to be a really long length of stay. It's going to be 5 years, 6 years, but you may only be able to help 2 or 3 animals every year because you have a smaller capacity for that. The length of stay is really long. But most of us work for regular animal shelters where our goal is adopting animals out, right, and not keeping them forever. And in that case, for those shelters, the guidelines say that 14 days is when we need to start to get worried. And this is 14 days total from intake to when they are on the adoption floor and all of the things that happen to them in the meantime. If you have an animal that is staying longer than 14 days, their enrichment needs go up. Can you imagine living in a Motel 6 for 14 days? That's a lot. It's a lot to ask. You could do it, but your quality of life would probably start declining. If you live in that, Hawaiian hotel resort for 14 days, I think you're going to be just fine. Averages and medians are also important to consider. So when I'm talking about length of stay, I'm talking about an average length of stay for all the animals of that particular type that are in your shelter. So I'm talking about the diabetic cat that stays there for 1.5 years and the little tiny kitten who comes in at 8 weeks, gets spayed the next day, gets adopted the next day. So I'm not going to go down the rabbit hole into medians, but if you want to know more about it, you can ask me or Mike Greenberg. Right there. Okay. So the nice thing about having a length of stay goal for your shelter is that it sets a benchmark for action for your team. So if 14 days is your length of stay goal, then any animal that is longer than 14 days should be flagged to your team that's doing daily rounds, and extra things should be happening for that animal. So extra enrichment, a bigger cage, a push on Facebook, an adoption event, anything that you can do to get that animal out of the shelter. Or, maybe they need extra behavior stuff because we thought this wasn't a problem, but it's turning out to be a problem, and now we need behavior intervention for this animal. Or maybe it's, okay, this animal is not getting adopted. It's not getting adopted because it looks really crappy. It looks really crappy, so we should probably do a vet exam. Oh, look, its kidneys aren't working. Okay, we're going to euthanize it. Hopefully that's not happening too often in your shelter. Length of stay of average in your shelter includes things like return to field, return to owner, and euthanasia. And so this is a great way to shorten your length of stay. If you aren't doing a return to field program for feral cats or even for stray cats, then this will drastically cut your length of stay for cats immediately. The minute you implement this program, you're going to notice your cat part of your shelter is like nirvana. It's amazing how few animals you have in your shelter if you do these types of programs. In terms of returning animals to their owners, in terms of returning to field, in terms of euthanasia, you shouldn't be sitting on these animals. These are animals that can have an immediate outcome if you do your job right. And so you should feel that sense of urgency to get the things that they need done. You've got to get that feral cat spayed and neutered so you can put it back. You've got to get that stray cat neutered so you can put it back. You've got to get that owner identified so you can call that person and you can get them back. Or this animal needs euthanasia. The reason it needs euthanasia is that it's suffering. If we let it suffer, not only is that bad for our length of stay, but it's really bad for that animal. So let's get that animal taken care of humanely as soon as possible. Why is length of stay such a big deal? Why do we get on our soapboxes about length of stay as vets, as managers, all the time? And this is why. It directly affects how many animals you have in your shelter. The longer my length of stay, the more work I have to do. Because instead of taking care of 100 animals, I have to take care of 200, and that's exhausting. That's when you start losing staff to burnout. Animals in-house need care. It costs money to take care of them every single day. They need feeding, they need services, they need staff to look at them. It affects how many animals you can help. This is that example where we have one cage and the cat's staying there all year, right? I'm not a very good animal welfare advocate if I can only help one animal a year, but I feel much better about myself if I can help 50. And then multiply that by the number of cages that you have in your animal shelter. The faster that animals leave, the more space and time you can devote to the others that also need you. It affects how you can help the animals. So the faster that these healthy animals leave, that's resources that you didn't spend on them that you can now spend on the ones that really need you. The ones that come in terrible shape, and you can rehabilitate them and get them looking fabulous and then out to an owner. And the owner doesn't have to make that leap of faith that whatever is going on with them is going to actually get better later on in life. And it affects animals. If you have too many animals in your house, if you're over capacity, your animals are going to get sick. I guarantee you. They're going to have poor behavior. They're going to be really frustrated. They're going to start lashing out, and they're going to be sneezing everywhere, and it's going to be terrible, and that's going to cause you even more work because now you have to isolate all these animals, and they have to be in ISO for 14 days, and you have to medicate everybody, and you don't have enough staff to do that because you have 200 animals instead of 100, and you're just everybody's stretched super thin, and you can see how this snowballs, right? And so that's why capacity is so important and why length of stay is so important, because length of stay directly affects your capacity in all of these different ways. Here's the real question, right? How do I make it different? Well, you can, lengthen your length of stay really easily by not letting any animals leave your shelter. That's a bad way of doing it. But you can also reduce intakes. So that's the first one. So doing TNR and managed admissions or time of appointments for your animals that are coming into your shelter, even if you're a municipal organization, you can have owner surrenders make appointments. You can do managed admissions for hoarding cases where you take some of them, and then you take some more of them, and then you take some more of them, and then you take some more of them, but over time so your staff isn't overwhelmed. Humane housing and enrichment. We just talked about the type of housing that I'm expecting you guys to have for cats, which is that double compartment or at least 8 square feet and bigger hiding place for cats. Well pets that live in those types of enclosures don't get sick. So they don't need to take that 2-week trip to isolation and get all that doxycycline. Good preventive medicine. So this is that intake procedures, this is the spay-neuter, this is isolating ill animals as soon as they get sick, which you're going to notice right away because you're doing daily rounds and discussing what their flow-through is. Working together with everybody on your team to keep these animals moving is really important. Because if you feel this sense of urgency and you're like, hey, let's get this animal out of here, hey, we can get this animal onto the adoption floor today if you just do this one thing, that you should do that one thing like right away so that animal can get onto that adoption floor and that adopter can come in and see it and leave with it that day. And if you feel that way, but maybe somebody else doesn't and they're just taking their time, and that's not going to help that animal at all. And that's when you start to, turn into what Dr. Berliner calls Dr. Meanie. And you say, no, this is happening today. We are doing this now because this animal needs me and the shelter needs this animal to be gone. Does that kind of make sense? Save room on your adoption floor if you reduce the number of spaces on your adoption floor to help with that decision fatigue type of thing for fast trackers. And what I mean by this is you can put 20 cats that are not that adoptable up on the adoption floor, and they're going to sit there for a while because that's what they do. But if you have 3 cages that you've reserved for kittens, those kittens will go pew, pew, pew out the shelter. And then you still have 17 slow track cats that are not that adoptable that then go 1 leaving. Okay, now I have 4 open cages and I can put kittens in all of them. Pew, 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 they're gone. So those slower track cats are not getting in the way of those faster track animals to get out of there. Yes?
What are your thoughts on holding back slow track animals to allow for more fast trackers?
So she's asking what my thoughts are about holding back slow track animals in order to get the fast track animals out of there faster. I think it's fine. There are equations that you can get where it will calculate based on your population the number of fast track spaces you should have and the number of slow track spaces you should have to optimize the length of stay for everybody. And it's usually like about maybe 3 or 4 cages to 20. But it depends on your shelter. And if you want those resources, I'm happy to share them with you. Reducing adoption barriers is really, really important. So if you require a landlord check, if you guys are requiring talking to veterinarians before you adopt animals out, if you require home inspections and making sure that people have fenced-in yards and making sure people are not going to let their cats outside and all of those things, chances are your length of stay is a lot longer than it would be if you didn't do those things. Now, you may work for an organization where that's important to the organization, and that's a philosophy thing, but you should understand the impact that it has on length of stay. In my personal opinion, my expert opinion, remember that's like sort of middle down in that evidence chain, right? Is that any home is better than the shelter. If somebody comes to your shelter to adopt an animal, it's because they want to have an animal to care for, and they want to do the right thing. That's all. And so you should send them home with an animal, if you can, at all possible. And keeping within capacity is the easiest way I know of reducing that length of stay. And so if you do all these calculations and you come up with a capacity of a certain number of animals, you should let everybody in your shelter know. And then you can do some adoption events, you can really push hard on things, try to get people adopted, send animals out on transport, whatever, to reach that number and then stay there. And what you'll notice, just really weird, based on the adoption-driven capacity, your outs and your ins are going to match up. And everybody's going to leave really fast because there's a certain number of people that want animals every year, and they come into your shelter every year at the same rate, and they take animals home at the same rate. And it's kind of great. And the way, it may not be the same way forever, so maybe you lose a transport partner. Now you'll have to recalculate your capacity numbers because your outcomes are going to be different. Or maybe there's another shelter that opened up across the street, and they're taking in half the animals that you used to take in. Woohoo! You don't have to take care of those animals anymore. They're being taken care of just fine. So now you can adjust your numbers based on your intake. Does that kind of make sense? So these numbers are not static. They're things you should revisit kind of on an annual or every 6-month basis and check and make sure that you're within your budget. How many of you guys have known shelters that had to close because they just got in debt too far and they went bankrupt, right? That's not a sustainable way to help animals. Even if it is kind of, also not a sustainable way to make your community happy. So, in summary, Sonia's laughing because I'm obsessed with this rabbit. I'm totally obsessed with this rabbit, but my dogs chase rabbits every morning for like the best enrichment of their lives, so I'm not taking it home. Every shelter has constraints, right? Imagine me trying to fit 3 bunnies in this pocket. It's probably not going to work. There are a lot of capacity numbers that you can calculate: budget, staff, housing, intake, adoptions. Those are all sort of the basic ones, but there are others, and if you want to talk about those types of capacity numbers, give me a call. I'm happy to do that. Most of those follow Little's law. So that's really the only equation that you really need to know. You can do all the calculations, and I would base them on basic standards, not gold standards, unless your shelter has a lot of resources and wants to invest all of those resources into your animals. And some do, but most of those are shelters that don't actually end up helping that many animals per year. Your true capacity is the lowest number that you get out of all the calculations that you make. And you can change those numbers, so you can get an extra grant, maybe your budget goes up and now you can help more animals. Or maybe you get a new spay-neuter surgeon who's lightning quick and now you can do more surgery for animals. But all of these things should be based on that lowest current number. And then your goal as your organization should be to try to figure out a way to increase those numbers if that's something that you want to do. Staying within capacity saves animal lives, a lot of them. And that's all I have. These are my critters. Thank you.